My name is Karen Ritter-Rice. I am an assistant professor at the School of Nursing, School of Medicine, the Duke Institute of Brain Sciences. I am also a pediatric critical care nurse practitioner and a Robert Wood Johnson Foundation Scholar. Head injury is the leading cause of death and morbidity in children, both for children at a young age but also adolescents. Falls in young children are the #1 reason, and motor vehicle crashes are in the #1 reason for adolescents. My research is trying to better understand what happens once a child's brain's been injured. There's some understanding that there are vessels within the brain that begin to spasm, and that then prevents the brain from getting the nutrients it needs and the oxygen it needs to both repair itself but also not to advance the injury. One of my goals is to see whether or not there is a gene that would help us better predict that spasming, and also whether or not the outcomes in children who have that gene look different because of their injury and their genetic profile. My work in the ADAPT Center looks at the actual challenges for the healthcare team while taking care of these children, but also the patients later, and then the families immediately during their healthcare experience. I'm looking to better identify what challenges do we as healthcare providers have while we care for these children, but also what are the families experiencing and what are they expected to anticipate when children go home. Their lives can look dramatically different in every way, and so identifying these challenges will help us better allow families, not the families and actually the patient themselves, to empower themselves to get well.